This is a podcast on adolescence and mental health, focusing specifically on art as an intervention. Created by Fergal, Kilkenny, Jennifer Shaughnessy and Ciara, who study Professional Masters of Education in Art and Design in November 2017.
And to look at art as an intervention in a general population suffering from mental health issues. A case study from the Journal of Psychiatric and Mental Health Nursing reported that results showed medication dispensed by nurses for anxiety and agitation was significantly lower on days when an image of a landscape was displayed, as compared to days when no art was displayed. The study concluded that positive distractions like visual art could help reduce mental health patients' anxiety in healthcare settings. It also makes a case that the environment can have a powerful impact on healing and must be explored further for the mental health setting. And to look at art as an intervention for adolescent mental health. A study in the journal Therapeutic Art Integrating the Visual Arts states, one approach potentially well suited for schools to address children's mental health issues, particularly those dealing with trauma, is the use of visual arts as a therapeutic agent. It states all art activities can encounter incompetent social skills, such as those witnessed in students with emotional behavioural disorder and autism spectrum disorders. It improves school engagement and reduces dropout rates, and visual art is proven to lend itself to being infused into larger cognitive behavioural interventions, which do have considerable support for children with mental health issues. And finally, this article concludes that there are two types of visual art therapy. Number one is art in therapy. The creation of art is part of the psychotherapeutic process. And number two is art as therapy. The creation of art is considered therapeutic in itself, without requiring further psychotherapeutic context.
In this section, I will focus on art's impact on mental health and also how art is currently being implemented by the government to improve citizens' quality of life and well-being. The image here shows how a teenager, whose behaviour led to an intervention by health professionals, sees his alcoholic mother. The two masks represent the two sides of his mother and her inconsistent behaviour towards him. The drawing conveys the pain and confusion of growing up with a parent battling alcoholism. Clinical art therapy can be effective for adolescents who usually see it as a non-threatening form of treatment. The art that the adolescents produce can help the therapist gain some idea of the youth's concern and life circumstances, especially those that are too risky to reveal or too personally embarrassing to relate. This awareness better equips the therapist in the efforts to protect and support the adolescent during this turbulent time of life. Has the government acknowledged the link between art and health? In 2008, the Arts Council, the Irish Government Development Agency for the Arts, appointed a specialist advisor on arts and health. Since 2008, this advisor has assisted in the development of arts and health policy and strategy for implementation in hospitals, schools and other state-run entities. One example of this policy and strategy being implemented is the use of art in the Under One Sky Commission installed in October 2017 at University Hospital Waterford. There is an emphasis here on the well-being of the patients through this initiative, and it is clear that the intervention of this creative piece is to transport the patient outdoors through the use of ceiling and wall paintings in the many wards. The initiative has seen young adults respond greatly to the commission, bringing the outdoors inside and improving mental health while being confined indoors due to their care needs.
The processes of doing, making and creating in the art classroom is definitely a huge factor in promoting mental health. It offers a sense of relief and expression, and students can infuse their thoughts and emotions into making a work of art. Creating is not just a nice activity, it transforms, connects and empowers. A 2014 article entitled Effects of a Classroom-Based Educational Resource on Adolescent Mental Health Literacy suggests that poor mental health literacy is a key barrier to help seeking for mental health difficulties in adolescence. Education is critical to enhancing mental health knowledge. However, the evidence base for educational interventions targeting youth is limited. To date, there have been 4 small randomized trials conducted in American and Pakistani secondary schools. These trials demonstrated promising findings among students following an educational intervention, including enhanced mental health literacy, attitudes, and willingness to seek professional help. However, this journal article states that there is a clear need for additional well-controlled research in this area. The studies carried out in this journal article provides preliminary evidence that Headstrong, a school-based educational intervention on mental health literacy, stigma, help-seeking, psychological distress, and suicidal ideation, is effective on improving mental health. This case study focuses on a total of 380 students in 22 classrooms from 10 non-government secondary schools in Australia. The effects of Headstrong is moderate to large, immediately at post-intervention but weakens over time, suggesting supplementary teaching is required throughout the year. This finding is consistent with previous research indicating positive associations between education and stigma reduction in adolescence. In Ireland, the new junior cycle curriculum was introduced in 2017 by the NCCA, and one of the main focuses of this syllabus is on well-being. As of this year, each student who enters first year will be faced with a framework of 24 statements of learning, along with 8 key skills. Some of these skills include managing myself, staying well, and being creative. To coincide with the linkage of art and mental health, an array of competitions are accessible specifically to Irish students to encourage this exploration into their own well-being. Last year, the theme for Mental Health Ireland's art competition was Mind Your Mental Health. As students of the PME in Art and Design Education, we as student teachers believe that the issue of mental health is essential to be introduced and explored in the art classroom. As we develop and create schemes of work around a selection of subject matters, it is important to consider the significance of mental health, and if we could bring this concern into our classrooms in order to make young people aware of the issue, to explore positive mental health, and allow students to be at the centre of this experience.
To conclude, art as an intervention provides many modes of help to adolescents suffering with mental health issues. Our findings in our 3 areas of study provide evidence that art serves a valuable purpose as an intervention for adolescents with mental health issues.